cancer remains a leading cause of death, but hope is being built. From policy advocacy to survivor support, individuals and organizations are working tirelessly to break down the barriers that stand in the way of effective cancer care.
The Kenyan Network of Cancer Organizations, KENCO, is the national umbrella body for cancer, civil society organizations, CBOs, and patient groups that are concerned in different aspects of cancer control in the country. At KENCO, we believe in turning compassion into action. Cancer is a growing burden, and the burden is expected to widen, especially if issues like access to care, access to rehabilitative programs, access to more cancer support and mental health programs are not implemented.
Sustainable change in cancer care requires a healthcare system that is inclusive and accessible to all. Strengthening these systems is key to ensuring that no one is left behind in the fight against cancer.
When the Cancer Prevention and Control Act was assented by the President to law, then one of the institutions that the Act created is the National Cancer Institute of Kenya. The Act gave the Institute 14 functions that they need to implement to the latter to make sure that we then reduce the burden of cancer, achieve our mandate. And for us to do this, we have a responsibility to provide leadership and governance in cancer care within the country.
Advocacy for cancer care thrives on collective action. Unified efforts are essential in driving systemic change and breaking down the barriers that limit access to care.
At KENCO, we've been doing a lot of work trying to educate the public, educate the primary healthcare workers and community health professionals, CHPs, so that we can be able to build this body of knowledge on what is cancer and what do we do when someone has been diagnosed with cancer. And that's why we're here, to be able to put together our heads and our hearts and our pockets to make sure that we are able to meet that great need.
With strategic investments in critical treatment facilities, strengthened healthcare partnership, policy advocacy, and sustained community-driven efforts, the journey towards accessible, life-saving care is becoming a reality for even the most vulnerable communities.
Through the Lions Clubs International, we have initiated a major program at the Kenyatta National Hospital, where in partnership with Texas Children's Cancer Hospital in the USA, we have given them over $1 million to rehabilitate the outpatient department at the Kenyatta National Hospital, and at the same time rehabilitate both their children's cancer wards. This is one of the initiatives that we feel will benefit many hundreds of children that are suffering with cancer and provide them with a facility that is not only equipped, but it has trained doctors, nurses, and personnel that can look after them and give them another new lease of life. One more initiative that we are embarking upon, and this is a need that we have realized, is that there are a lot of children out there that come for chemotherapy to Kenyatta National Hospital as outpatients. Many of them come from different counties around Kenya. Some of them even come across the borders, and their parents and caretakers are improvised, and they really do not have any means to stay in the city of Nairobi for the duration of the treatment of their child, which could take anywhere between 4 weeks, 6 weeks, 8 weeks, or even 10 weeks sometimes, because chemotherapy is a process. And during the time the child is getting treatment, they need to find a place to stay. And of course, having no means, it makes it very difficult for them to make a choice, either to stay in the city of Nairobi and get their child treated, or if they don't have money, forfeit the treatment of their child and go back to the village. So this is what we have seen that happens on the ground, and we are in the process of setting up a 48-bedded hostel at the Kenyatta National Hospital. They've given us a piece of land just across the pediatric outpatients clinic, where we are going to set up this 48-bedded hostel that will help and facilitate most of the parents and caretakers to stay within the facility, get their children treated during the duration of the time, and go safely back home, thus not incurring a lot of cost. I'm so happy with the work that KENCO is doing in Kenya by bringing 65 different organizations under one umbrella. And the work that they are doing of aligning all these 65 organizations, putting them in the right direction, giving them guidance, and giving them the necessary resources, I think we can win the war against cancer in our country of Kenya.
Resources are vital to expanding access to cancer care. Building a sustainable resource base is crucial in overcoming barriers to treatment and providing long-term support.
One of the gaps that we have realized through all our activities was fundraising and resources. And one of our pleas, or one of our call to actions to everyone who is watching this and to our friends and partners, is that we want everybody to come on board, want everybody to come and join us and support the KENCO initiatives financially. And one of our initiatives is the Benevolent Fund. And the fund will seek to support cancer survivors, cancer patients, to ensure they get access to care, they get access to rehabilitative commodities, they get access to their insurance through paying their insurance premiums, through paying even their transport, just to ensure a holistic point of care for all of these cancer patients. Come and partner with us as KENCO. We are happy to have you, and we are excited for an impactful 2025.
Being diagnosed with breast cancer was unbelievable. We went for a second, third opinion to just check out if that was it. So how it came about for me to be diagnosed is that I had gone for a medical camp in 2014, and I learned how to do self-breast examination. So I was doing this regularly, and that's how I found a lump. And once I found it, I went to a clinic to have it checked. It was ruled out as hormonal imbalance. So it took me approximately 3-4 different hospitals and about 7 months to be diagnosed. I was diagnosed with stage 0 breast cancer, which is now the earliest stage it can be diagnosed. This was now in 2016, and because I didn't know a lot about cancer, including my family, we didn't particularly know how to go about it, what tests to do, what surgeries, or which specialist to go to. So I ended up doing a lumpectomy, which is removal of the lump and the surrounding tissues without even knowing it's a lumpectomy, and this was done before the diagnosis. So the surgery wasn't done properly. So when I was about to do radiation, the doctor noticed that I still had lumps in my breast. So I had to do a mastectomy, which is removal of the whole breast.
Cancer care goes beyond physical treatment. Providing emotional and psychological support to survivors and their families is just as crucial in the healing process.
In Kenya, there was a real gap in terms of supportive services. So whether it's to do with just finding someone you can talk to who's gone through the same journey, knowing what to do about your nutrition, your mental health, etc. So we started 14 years ago. And one of the key things we do is support group meetings. And I find that they're really useful because when you've just been diagnosed and you meet someone who's had cancer 2 years ago and are doing well, it gives you a lot of hope. So we do several support group meetings. We do breast cancers, gynecological cancers, blood cancers. At Kenyatta, we do support group meetings with parents and a whole range of others. And we find that patients come and interact in a safe space and get a lot of hope through these support groups. And one of the other things we do, which is very, I think, useful for cancer patients, is therapies. So people can come and take advice for nutrition, come and have counseling sessions. We do some energy-based healing. They can also come and have fun. We have Zumba classes. And just, I think from my experience, I had cancer 21 years ago. I know that when you're feeling good, your recovery will be better as well.
Join us one more time as we rally together our resources, our networks, our friends, our families, our organizations, our businesses, and pick cancer patients, work with them to ensure they access the much needed care and support, not only the medication, but also rehabilitation and mental health and psychosocial support that they so much need during this journey.